Hi, hello friends, welcome to my channel, The Voice of Nurse. Good morning, friends. Here discussion regarding TS Telangana State Staff Nurse 2023 questions and answers. FAQ frequently asked questions in previous years. This is part 2, friends. In previous video we already discussed regarding TS Staff Nurse 2023 questions and answers from the first question number 1 to question number 30. From the 31 to 70 we will discuss in this video. Move on to topic. Small request, friends. Please subscribe my channel, like a video, share a video and click on the bell icon for further notifications. Discuss part 2 Telangana State Staff Nurse 2023 question number 31st to 70. The number of temporary teeth are options. Option A 20, option B 10, option C 32 and option D 24. Here the temporary teeth, the number of temporary teeth are 20. Permanent teeth are 32. In the childhood, in the children's having just 20 teeth. The temporary teeth also called as primary teeth and also called as milk teeth. Okay friends, here option A is the correct answer. Temporary teeth are 20. See here in this picture 20 milk teeth. What are those? 4 central incisors, 4 lateral incisors, 4 canines, 4 first molars, 4 second molars. Those are 20 milk teeth we are having in children's. Okay friends, next move on to question number 32. The average amount of saliva secreted daily in human approximately. We will see the options. Option A 1 liter, option B 2 liters, option C 1.5 liter and option D 5 liters. Here option C is the correct answer, 1.5 liters. The normal daily production of saliva is between the 0.5 ml to 1.5 liters. Here the option C is the correct answer. The rate will be decreased during the sleep and the amount of saliva secretion will be increases during the eating and chewing and also some of the exercises. When we are doing some of the exercises, that time also the saliva will be increases the amount. So here 1.5 liters is the correct answer. The average amount of saliva is 1.5 liters. Next move on to question number 33. When blood calcium levels are too high, the thyroid releases what hormone? Okay friends, when we are having the blood calcium levels are high, in that time the thyroid gland will release the which hormone? Options: option A calcitonin, option B adipose, option C hemoglobin and option D serum. The calcitonin is a hormone secreted by the thyroid gland. So here option A is the correct answer, calcitonin. Calcitonin is acts to reduce calcium levels in the blood. Okay friends, option A is the correct answer. Next move on to question number 34. The old red cells are restricted by, means the old red blood cells will be destroyed by the following options. Option A tissue morphages, option B T cells, option C natural killer cells and option D none of the above. Here the old red blood cells, means the old red cells will be destroyed by tissue morphages. Option A is the correct answer. Blood cells that cannot pass the test will be broken down in the our body and spleen by macrophages. Okay friends, the test will be broken down in your spleen by the macrophages. Macrophages are large WBC that specialize in destroying these unhealthy RBCs. Here option A is the correct answer. Next we will see the question number 35. The main buffers of blood pH are options. Option A electrolyte and glucagon, option B bicarbonate and ammonium, option C insulin, and option D all of the above. Here the main buffers of blood pH is bicarbonate and ammonium. Option B is the correct answer. The pH of blood is 7.4 by the carbonic acid bicarbonate ion buffering the system. Bicarbonate is the most important buffer for maintaining pH of hemostasis of blood. So here option B is the correct answer. Bicarbonate ammonium is the main buffer of the blood pH. Next we will see the question number 36. Which among the following is example of lymphoid tissues? Okay friends, what is the example of lymphatic tissue is following the options. Option A thyroid gland, option B pancreas, option C spleen and option D adrenal gland. Okay friends, here option C is the correct answer, spleen. The spleen is the largest lymphatic organ in the body. Spleen consists of two types of tissues called as white pulp and red pulp. Okay friends, spleen is having two types of tissues. Those are white pulp and red pulp. Okay friends, in the white pulp, the lymphatic tissue, we are having lymphatic tissue. White pulp is lymphatic tissue. Okay friend, option C is the correct answer, spleen. In this image, we can see the spleen. In the cross section of spleen, we can see here bottom of the spleen the white pulp. Okay friends, white pulp means lymphoid tissue. Lymphatic tissue means lymphoid tissue. Here option C is the correct answer, spleen is example of lymphoid tissue. Next move on to question number 37. Oliguria means urine output following. Option A less than 0.5 ml per kg per hour. Option B 0.7 ml per kg per hour. Option C less than 0.8 ml per kg per hour and option D 0 ml per kg per hour. Okay friends, what is oliguria? Oliguria means the urinary output is less than 400 ml per day. Okay friends, oliguria means the less than urine output is 400 ml per day. Here in this option, less than 0.5 ml per kg per hour is the correct answer. And oliguria means less than 400 ml urine output in the 24 hours of day. Means and also otherwise 400 ml or less than 20 ml per hour also we can calculate. Oliguria we can see in which cases? Due to the underlying diseases like dehydration and also CKD or any renal diseases, we can see the oliguria cases. Next, move on to question number 38. The frequency of assessing the site of restraints in routine practices. Okay friends, when we are assessing, which time we have assessed the restraint patient. What is the meaning of restraints? Restraint means keep someone or something under the control. Okay friends, we will see the options. Option A every 2 hours. Option B every second hours means every 2 hours. Option C every 3 hours. Option D every 4 hours. Here every second hour is the correct answer, means every 2 hours we have to assess the restraint patient. Restraints can be cause the injuries and distress due to the restriction. So every second hour means 2 hours once we have to assess the patient. For patient need to be checked at least every 2 hours once. Here we can see in this picture restrained patient on the bed. Okay friends, restrained patient. Okay friends, here option B is the correct answer. Next move on to question number 39. While performing wound dressing, nurse should clean the wound from. Okay friends, when we are as a nurse performing a wound dressing, nurse should be clean wound from the protocol. We are having protocol clean area to infected area. Okay friends, we will see the options here. Option A, center to periphery. Option B, periphery to center. Option C, clean area to infected area. And option D, infected area to clean area. Here option C is the correct answer. The role of the nurse. Nurse should do dressing through the clean area to from the clean area to infected area. This can be reduces risk of infections and encourages the wound healing. Here we can see the picture. Wound cleaning is going on. This is the some of the peak. Okay friends, the role of nurse or the nurse is performing wound dressing from the cleaning area to infected area to risk, reduces the risk of infection and encourages the wound healing. Here option C is the correct answer. Next we will move on to question number 40. Gastric juices consist of except option A HCl, option B pepsin, option C trypsin, and option D intrinsic factor. Here trypsin is secreted by the small intestine. Okay friends, here gastric juices consist of except the following, means in from the options one is not related to the gastric juices. Here option A HCl, B pepsin, C trypsin and intrinsic factor. The option C trypsin is the secreted by the small intestine. Okay friends, so this is not related to the gastric juices. The trypsin is essential for human body to digest protein and building and repairing the tissue including the bone, muscles and skin and also blood. Here trypsin is except condition of gastric juices. Next move on to question number 41. Determinants of blood pressure are following except. Okay friends, from the options one is the except condition of determinants of blood pressure. We will see the options. Option A pumping action of heart, option B peripheral vascular resistance, option C intravascular fluid volume, and option D intracellular fluid volume. Okay friends, what is determinants? Determinants of blood pressure means the condition and outcome. Okay friends, determinants means the condition and outcome. Here the except is option D intracellular fluid volume. Hemodynamic determinants of blood pressure includes cardiac output, peripheral vascular resistance and intravascular volume. So here option D is the except of question. Next move on to question number 42. Which human body system produces enzymes? Option A renal, option B digestive, option C cardiovascular and option D central nervous system. Here the human body system produces enzymes means option B digestive system. So pancreas, in the digestive system pancreas is the produces enzymes. Your pancreas makes pancreatic juices called as enzymes. Okay friends, enzymes. The enzymes break down sugar and fat and starches. Here option B is the correct answer. Human body system produces enzymes, digestive system, that is the pancreas. Next we will move on to question number 43. If the patient can take breath only in sitting or upright position is termed as. Okay friends, when patient is taking breathing in sitting position or upright position is called as from the following. We will see the options here. Option A euphonia, option B dysphonia, option C orthopnea and option D paroxysmal nocturnal dysphonia. Here orthopnea is the correct answer. Option C, when patient is breathing in the sitting position or upright position is called as orthopnea. We will see the options, meanings of the option. These are the medical terms. Okay friends, euphonia. Option A euphonia. What is meaning of euphonia? Euphonia means normal breathing rate depending upon the age of the patient. Next dysphonia. Dysphonia means in the option only is there, dysp means the difficulty or shortness of breathing. Option B, dyspnea means shortness of breath. Next, option C, orthopnea. Orthopnea means harder to breathe when you are lying down because of some of the fluid or any infection to our lungs. Okay, friends, and harder to breathe and lie down because of fluid in our lungs. Here, option C is the correct answer. Orthopnea. What is meaning of proximal nocturnal dyspnea, PND? PND means sensation of shortness of breath that awakens the patient after 1 hour or 2 hours of the sleeping. They will feel shortness of breath after 1 hour or 2 hours of sleep. Here in this question, breath only. Patient can take breath only in the sitting or upright position is termed as orthopnea. Option C is the correct answer. Move on to question number 44. The amount of gastric juices secreted daily. We will see the options here. Option A 1.5 liters, option B 5 liters, and option C 7 liters, and option D 3 liters. Here in this question, amount of gastric juices secreted daily. This 44 question. In this video, in previous 32 means 32 question is the average amount of saliva secreted daily. That is related to the saliva. This is related to the gastric juices. Don't confuse, friends. Those both questions are different. Okay, friends, we will see here in 44 question, amount of gastric juices secreted daily. Gastric mucosa secretes 1.2 to 1.5 liters of gastric juices per day. Here option A 1.5 liter gastric juices secreted daily is the correct answer. Next, move on to question number 45. Fluid balance through various mechanism of body. Okay, friends, the fluid balance equivalence of mechanism of body is called as options. Option A hemostasis, option B toxicity, option C osmoregulation, and option D thermoregulation. Here option C osmoregulation is the correct answer. Osmoregulation is the process of maintenance of salt and water balance or osmotic balance across membranes in the body fluids. Here control of fluid balance through the various mechanism of body is called as osmoregulation. In this clip we can see here the osmoregulation, the picture, but this is not clear. I will show you. Here we can see here in right side and left side the urine output and urine concentration, small volume of concentrated urine and large volume of dilated urine. The water content of blood normal means the equivalence. The fluid balance is mechanism control. The control of fluid balance through the various mechanism is, we can see here in this picture, option C, the osmoregulation. Equivalence is present in this picture. Next, move on to question number 46. What is the main component in the primary hemostatic plaque? We will see the options. Option A platelets, option B thromboxamine, option C bleeding factor, and option D clotting factor. Here in this question, primary hemostatic plaque component, but primary hemostatic plaque also called as platelet plaque formation. Okay, friends, platelet plaque formation. So in this question only is there answer platelets is the correct answer. The first step of hemostatic and is the process where a platelet plaque forms to prevent further loss of blood from the damaged vessels. Here option A is the correct answer, platelets. I will show you one image coming quick. Here we can see the platelet plaque formation. This is not visible now. I will show you clear. One second, friend. Here we can see here platelet plaque formation. Okay, friends, platelet plaque formation. The prevention will be happen here. Prevent further loss of blood from the damaged vessels. Okay, friends, the platelet plaque will control the bleeding. So here option A is the correct answer. Main component of primary hemostatic plaque is platelets. Next, move on to question number 47. The end of product end product of digestion of protein is? Options: option A amino acids, option B glucose, option C fatty acids, and option D minerals. The chemical digestion of protein starts from the stomach, end is small intestine. Okay friend, the chemical digestion is present from the stomach to ends small intestine. The end product of protein digestion is amino acids. Option A is the correct answer here. Here we can see in this picture the protein through the pepsin, it will be digest large polypeptides, then it will be short peptides and amino acids, and end product of digestion of protein is amino acids. We can see here in this column. Option A is the correct answer, amino acids. Next, move on to question number 48. The pH of intestinal juice. Options: option A acid, option B basis, option C natural, and option D none of the above. Here not mentioned what is the pH of intestinal juice. Here the pH of intestinal juice is acidic or basic. Here option B is the correct answer, basic. The human small intestine has slightly basic environment with pH of juices. Okay friends, between the 7.5 to 8.5 is the pH. Okay friends, pH is fluctuation is there in the intestinal juices from the ileum, caesium and duodenum. The pH of ileum is 6 to 7.4. Next, it will be decreases in the caesium 5.7. Then it gradually increases in the 6.7 in small intestine. In the duodenum, the pH level is 6 in duodenum. Here, the basic pH of intestinal juice is basis. Option B is the correct answer. Next, move on to question number 49. Functions of stomach are accept. From the following, one is the accept function of stomach. You will see the options: temporary storage of food, option B digestion of stomach, option C production of intrinsic factor, and option D absorption of food. We have to know the what are the functions comes under the stomach. Okay friends, we have to know the stomach functions. Here temporary storage of food is present in functions of the stomach. The main function of the stomach is digestion of the food, and also production of intrinsic factor also is present in functions of the stomach. These three functions, these three are the accept function of the stomach is digestion of the food. Okay friends, these three are the functions of stomach. The accept function of the stomach here, option D, absorption of food. Absorption of food is present in small intestine. Okay friends, option D is the accept of condition in functions of the stomach. Next, we will see the question number 50th question. What are the chemicals that help to maintain proper pH balance? Okay friends, which chemicals can help maintain the proper pH balance? Following the options: option A buffers, option B fatty acids, option C electrolytes, and option D uric acid. Option A is the correct answer. Buffers is a solution that can resist the pH change upon the addition of a acidic or basic components. Here option A is the correct answer. Option A buffers chemicals that help maintain proper pH balance. Okay friends, next move on to question number 51. Nurse should maintain the head of bed elevated to 30 degrees during and 2 hours after feeding to prevent following. Actually, the nurse maintain head bed elevated 30 degrees during the and after 2 hours of feeding. What is the condition we can prevent from the following options? Option A gastric emptying, option B tube displacement, option C pulmonary aspiration, and option D tube occlusion. The prevention of condition from the following option is pulmonary aspiration. Option C is the correct answer here. We can prevent the pulmonary aspiration, means aspiration of the food. We can prevent through the bed elevation approximately 30 degrees angle and 2 hours after the feeding of patient. A condition in which food, liquids, saliva or vomit is breathed into the airways is called as pulmonary aspiration. So, we can prevent through the head and bed elevation approximately 30 degrees of angle. Option C is the correct answer here. Next, move on to question number 52. Which hormone causes bones to release calcium and the intestines to increase their absorption of calcium? Here in this question, which hormone causes bone releases calcium, the absorption of calcium from the following options? Option A, monoglycerides, option B, ammonium, and option C, parathyroid glands, and option D, triglycerides. Here, option C is the correct answer, parathyroid glands. Parathyroid hormone produced by the thyroid gland helps to maintain the right balance of calcium in bloodstream and tissues as well as bone healthy. The parathyroid gland is located behind the thyroid at the bottom of our neck. Okay friends, here option C is the correct answer. Parathyroid gland can cause the bones to release calcium to maintain the balance in the bloodstream and tissues. Option C. Next, we will see the question number 53. Pancreatic juice consists of enzymes from the following except option A pepsin, option B amylase, option C lipase, and option D trypsin. Here the pancreatic juice consists of, okay friends, pancreatic juice consists of enzyme here amylase, lipase and trypsin. These three enzymes serve a crucial role in digestion. Here the enzyme except in the pancreatic juice is pepsin, option A. Pepsin is not present in pancreatic juice. So here except option is option A. The pepsin is secreted by the peptic cells of the stomach. Okay friends, peptic cells of the stomach. Pepsin is secreted by peptic cells. So here option A is the correct answer, pepsin. Next, move on to question number 54. The point of maximum impulses of cardiac apex is best located yet. Okay friends, cardiac apex impulses best location at the point of following options. Option A, fifth intercostal space just medial to the left mid-clavicular line. Option B, fifth intercostal space just lateral to the left mid-clavicular line. Option C, sixth intercostal space just medial to the left mid-clavicular line. And option D, sixth intercostal space just lateral to the left mid-clavicular line. Here option A is the correct answer. The point of maximum impulses of cardiac apex is the best position we can locate here. Fifth intercostal space just lateral to the left mid-clavicular line. Okay friends, medial to the left mid-clavicular line is the correct answer. Here option A. We can see here in this picture mid-clavicular line is present in underlining here in the left side. The mid-axillary line we can see here bottom of the picture. The fifth intercostal space just medial to the left mid-clavicular line is the correct answer. Option A is the correct answer. Next, move on to question number 55. While placing bedpan, the nurse should do the following except. From the following, the nurse should have to avoid during the bedpan, placing the bedpan. Options. Option A, keep the head of the bed 30 degrees elevated. Option B, keep the head and bed flat. Option C, ask a patient to bend the knees. And option D, all of the following above. Here option B is the except condition for the placing bedpan. Nurse have to avoid keep the head and bed flat. Because when we are keeping bedpan, we have to avoid head is flat and patient is flat position. Because when patient is flat position, some of the condition, the oxygen supply will decreases to the heart. Low blood supply to the heart and ischemic condition will happen. In the situation, patient can cardiac arrest will be done. Patient can be arrested during this situation. Before we have to do anything, we have to explain the patient conditions and explain the procedure. Here except is option B, keep the head and bed flat is the except condition. Next move on to question number 56. The only artery which supplies deoxygenated blood. Options: option A, pulmonary artery, option B, hepatic artery, option C, gastric artery, and option D, renal artery. Here option A is the correct answer. Pulmonary artery can carry blood from the right ventricle of the heart to the lungs for oxygenation. Here option B, hepatic artery, it is related to the liver, gastric artery related to the stomach, and renal artery related to the kidneys. Here only artery which supplies deoxygenated blood carries to the from the right ventricle to the heart for deoxygenate, means deoxygenated blood can carry to the lungs for the oxygenation. Option A is the correct answer. Here this coming pic, we can see here the pulmonary arteries with green circled. In the upper portion of the heart, we are having pulmonary arteries. We can see here pulmonary arteries. Next move on to question number 57. Haversian canal. Haversian canal are found in options: option A, brain, option B, lung, option C, bone, and option D, kidney. What is meaning of Haversian canal? Actually, what is Haversian canal? We have to know. Haversian canal is a network of tubes found in the compact bones. Here we can see in bones only Haversian canal. Haversian canal, this is compact bones. We can found in compact bones. This allows to bone receive oxygen and nutrients without visualization. We can't see in the bones, we can see the Haversian canal in the cross section of the bones. Okay friends, Haversian canal we can found in the bone. Option C is the correct answer. On to question number 58. Normal platelet count in human beings. Options: option A, 25,000 to 50,000, option B, 4 lakhs to 6 lakhs, option C, 6 lakh to 4 lakhs, and option D, to 5 lakhs. Here option C is the correct answer. 1 lakh to 4 lakhs is the normal platelet count. The normal platelet count is 1 lakh to 1,50,000 to 4,50,000 in microliters of blood in adults. The platelet count is in case of below 10,000 means below 10,000 macroliters of blood means internal bleeding is present, means this is the serious situation and emergency condition also. So here normal platelet count is present. Option C, 1 lakh to 4 lakhs is the correct answer. Next move on to question number 59. The smallest form of vein is known as. Okay friends, what is the smallest form of vein is called as? Options: option A, vein, option B, venules, option C, vena cava, and option D, sinus. Here option B is the correct answer. Smallest vein is known as venules. We can see smallest cardiac vein is called as Thembensian vein, which is present in the wall of the heart and drains the myocardium. Okay friends, the smallest form of vein is called as venules. Option B is the correct answer here. Next move on to question number 60. In following, which one is exocrine and endocrine gland? Okay friends, here from the options, one is exocrine and endocrine gland. Option A, adrenal gland, option B, pancreas, option C, thyroid, and option D, pituitary. Here exocrine endocrine gland we are having pancreas and liver. In this option, option B is present pancreas. Pancreas is the exocrine and endocrine gland, but we are having liver and pancreas are both exocrine and endocrine glands. Pancreas helps to the digestion of the food. Pancreas with help to digestion of the food. Here option B, exocrine endocrine gland is pancreas. You can see here in this picture pancreas image. Friends, next move on to question number 61. What is the main component in the definitive clot? Options: option A fibrin, option B thrombin, option C platelets, and option D RBCs. Definitive clot is fibrin. Option A is the correct answer. Fibrin is a fibrous non-globular protein involved in the clotting of blood. Okay friends, fibrin is a fibrous non-globular protein involved in the clotting of blood. Here option A is the correct answer. Fibrin is main component of definitive clot. Option A. Next move on to question number 62. When the body is cold, what muscle in the skin contract to make hair stand on the end? Options: option A erector pili, option B vasodilation, option C Exocrine, and option D all of the above. Here when the body is cold, the muscle will skin contract make hair stand is erector pili. Erector pili or erector pili muscle. APM. Erector pili muscle consists of a small band of smooth muscle that connects the hair follicles to the connective tissue of the basement of membranes. Here option A is the correct answer, erector pili. Next move on to question number 63. The temperature measured at the rest. Okay friends, the temperature measured at the rest is called as options: option A euthermia, option B basal body temperature, option C core temperature, and option D regular temperature. Here option B not Bedal friends, some of the typing errors is present. Basal body temperature, but temperature measured at the rest is called as basal body temperature. Option B only correct answer. Here option A euthermia. Euthermia means normal body temperature. Basal body temperature means lowest body temperature attaining during the rest. Okay, here option B is the correct answer. Next, core temperature. What is meaning of core temperature? Core temperature between the 36.5 degrees to 37.4 degrees Celsius temperature of internal organs such as heart, liver, brain, and blood. So here temperature measured at rest, option B is the correct answer. Next move on to question number 64. Antibody-mediated immunity is provided by from the following. Antibody-mediated immunity is provided by options: option A T lymphocytes, option B B lymphocytes, option C A and B, and option D RBCs. Here option B is the correct answer, B lymphocytes. B lymphocytes are part of the immune system. Development from the stem cells in the bone marrow. B lymphocytes also called as B cells. The B lymphocytes also called as B cells. Blood cells development also is done in B lymphocytes. Here option B is the correct answer. B lymphocytes is the antibody mediated immunity providers. Next move on to question number 65. What is the normal osmolarity of plasma? We will see the options here. Option A 320 m osmolarity per liter. Option B 270 m osmolarity per liter. Option C 400 m osmolarity per liter. Option D 290 m osmolarity per liter. Here plasma osmolarity. The normal range is 275 to 290 m osmolarity. Okay friends, 290 m osmolarity per kg. Here option D is the correct answer. Normal osmolarity of plasma is 290 m osmolarity per liter. Plasma osmolarity is tightly maintained with the normal range of 270 and 290 osmolarity per kg. Plasma osmolarity measures electrolytes and water balance. Okay friends, next move on to question number 66. What is the main anti-clotting component in the blood? Options. Option A heparin, option B protein C, and option C antithrombin 3, and option D none of the above. The antithrombin 3 is the correct answer. The main anti-clotting component in the blood, antithrombin 3. It is a protein in the blood that blocks abnormal blood clots from the forming. It helps to the body keep healthy balance and between the bleeding and clotting factors also. Here option C is the correct answer. Next we will see the question number 67. A hormone that causes rapid but short lasting heat production is options. Option A FSH, option B growth hormone, option C epinephrine, and option D LH. Here the hormone that causes rapid but short lasting heat production is option C epinephrine. Epinephrine or adrenaline. Epinephrine is also called as drug. Adrenaline, in the form of adrenaline we can know. Epinephrine is injection is used to along with emergency medical treatment to treat the life-threatening allergic reactions. Okay friend, some of the times we can use for the cardiopulmonary resuscitation, CPR. In situations also we can use epinephrine or adrenaline. Here the hormone that causes rapid but short lasting heat production is epinephrine. Option C is the correct answer. Next, move on to question number 68. Following which structure is also known as pacemaker of heart? Here pacemaker of heart is called as SA node. SA node means sinoatrial node. We will see the options here. Option A AV node, option B SA node, option C bundle of His, option D mitral valve. Here option B is the correct answer. SA node is considered as pacemaker of the heart. SA node generates an electrical signals to the heart of the upper portion of the upper chambers of the heart to contract. Through the AV nodes, the signal passes to the lower chambers of the heart. Here option B is the correct answer. SA node is the pacemaker of the heart. In this picture we can see here in upper portion of the heart, upper chambers of the heart, we can see the SA nodes. The lower chamber is bundle of His, in between is AV node. Through the AV node the electric impulses signals passes to the lower chamber of the heart. Here SA node is called as pacemaker of the heart. Option B is the correct answer. Next move on to question number 69. Cell mainly involved in immunity. Options. Option A RBCs, option B lymphocytes, option C platelets, and option D renal cells. Lymphocytes is the correct answer. The cell mainly involved in the immunity is lymphocytes. We are having two main types of lymphocytes. One is B lymphocytes, second one is T lymphocytes. B lymphocytes make antibodies and T lymphocytes help to kill tumor cells and help to control the immune system and immune response. Here immunity are involved in cells. Option B is the correct answer, lymphocytes. Next move on to question number 70. Total number of muscles in human body are options. Option A 200, option B 650, and option C 400, and option D 300. Here option B is the correct answer. The estimated that there are over 650 named skeletal muscles in our body. The muscles are body perform a variety of functions and variety of vital role. Option B is the correct answer. 650 muscles we are having in human body. This is the last questions in part 2 video, Telangana State 2023, from the previous questions. This is part 2 friends. We will continue next video from the 71 question to 100. Thank you for watching my video. Please subscribe my channel. Click on the bell icon for further notifications. Stay tuned friends. Thank you. Keep watching.